Welcome to our channel. Today, we're diving into a topic that can be a little, well, uncomfortable to talk about: vaginal infections. But trust me, it's important. Just like we talk about other health issues, we need to normalize conversations about vaginal health. It's so common to experience these infections at some point in our lives. We're going to cover the most common types of vaginal infections, what causes them, the symptoms you should look out for, and the treatments available. Don't worry, we're going to break it down in a way that's easy to understand. Let's talk about bacterial vaginosis, or BV. BV is an imbalance in vaginal bacteria, not an infection. Our bodies are amazing ecosystems. Just like our gut, our vagina needs good bacteria. BV occurs when bad bacteria outnumber good ones. Symptoms include thin, grayish-white discharge and a fishy odor, especially after sex. BV is treatable with antibiotics like metronidazole or clindamycin. Next, let's tackle those pesky yeast infections. We've all been there, right? That unbearable itch, the burning ugh. Yeast infections are caused by an overgrowth of candida, a fungus that normally lives in the vagina. But sometimes things get out of whack. Antibiotics can wipe out good bacteria, letting candida flourish. Pregnancy, diabetes, and stress can also make you more susceptible. The classic symptom is a thick white discharge, and of course that intense itching and burning. Thankfully, yeast infections are easy to treat with over-the-counter antifungal creams. For stubborn cases, your doctor might recommend oral fluconazole. Now let's move on to trichomoniasis, or trich as it's commonly called. This one's a bit different because it's a sexually transmitted infection, meaning you get it through sexual contact. The culprit? A tiny parasite called Trichomonas vaginalis. Now, trich can be sneaky because sometimes you don't have any symptoms, but when you do, they can be pretty uncomfortable. Think greenish-yellow, frothy discharge, a strong unpleasant odor, and pain during urination or sex. Don't worry, trich is treatable. Your doctor will likely prescribe metronidazole, the same antibiotic used for BV. And here's the important part. If you're diagnosed with trich, your partner needs to be treated too, even if they don't have symptoms. This helps prevent spreading it back and forth. Let's talk about chlamydia and gonorrhea. These bacterial infections are often silent, so regular testing is crucial. Symptoms can include discharge, burning during urination, and pelvic pain. Untreated, they can cause serious issues like pelvic inflammatory disease. The good news? Both are curable with antibiotics. Ensure your partner gets treated to prevent reinfection. Last but not least, let's talk about vaginal atrophy. This one's not an infection, but rather a condition that can happen after menopause when estrogen levels decline. Estrogen plays a big role in keeping the vaginal tissues healthy and lubricated. So when estrogen levels drop, things can get a little, well, dry and irritated down there. You might experience dryness, itching, painful sex, and even an increase in vaginal infections. But there's hope. Your doctor can recommend treatments like estrogen creams or vaginal moisturizers to help restore moisture and relieve those uncomfortable symptoms. That was a lot of information, but I hope you found it helpful. Remember, knowledge is power, and understanding your body is the first step to taking control of your health. Remember, prevention is key. Practice good hygiene, avoid douching, wear cotton underwear, practice safe sex, and limit antibiotic use. These simple steps can go a long way in preventing those pesky infections. And if you're experiencing any unusual symptoms, don't hesitate to reach out to your healthcare provider. They can help determine the cause of your discomfort and recommend the best course of treatment. Thanks for watching, and don't forget to like and subscribe for more informative content.